Okay, so this is really important because the whole idea of cycles is that the child has to be stimulable for these targets, and they should be like easy wins. They have highly facilitative contexts that make the word like a lob for the kid to say. That's how I think of it.
Hey SLPs, I'm Michelle and this is the Pep Talk podcast for continuing education. This podcast provides furthering knowledge on topics related to speech-language pathology. I interview experts in our field to bring you the most up-to-date information so you can go out into your workplace and feel more confident and learn new skills. You can use this episode for a professional development hour to maintain your ASHA CCCs. This course is also certified by the Texas Speech and Hearing Association, also known as TSHA. You must complete the course quiz with a passing score to earn your certificate of completion. You can find more information, other courses, and helpful tools on my website, peptalkpodcastforslps.com. Connect with me on Instagram, Facebook, or email me at michelle@peptalkpodcastforslps.com. I love hearing from you guys. Please don't hesitate to reach out. Just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. Pep Talk Podcast, its host and guests do not represent or endorse specific products or procedures mentioned during the episodes unless otherwise stated. Each episode topic has been carefully chosen to fill an educational need. If you have an additional perspective or any information to contribute, or if you need special accommodations to participate in this course, please reach out at info@peptalkpodcastforslps.com. This entire episode is transcribed if you would like to or need to read this episode in text. Hey everyone, I'm Michelle Andrews and I'm your host for the Pep Talk podcast, where today we are learning all about choosing target words while using Hodson's cycles approach with my guest speaker, Suzanne Aldrich. Suzanne has extensive experience using and teaching about the cycles approach. I can't wait for you to learn all about what she has to teach us. This is the first episode of the Pep Talk podcast, so let me tell you a little bit about myself. I've been a speech-language pathologist for almost 8 years now. I have worked in the pediatric population, in the schools, private clinic, and home health. I have focused on speech-sound disorders and early language delays, but enjoy the whole spectrum of speech pathology. I graduated with my master's degree from Texas Women's University in 2014, and that same month I married my college sweetheart, and we have 3 wonderful children. I love learning, I loved school, so I'm here to continue learning and to help you do the same. Before we get into our topic, I need to go over some financial disclosures. My financial disclosures include I have a Teachers Pay Teachers, Boom Learning, and Teach with Medley store all under Pep Talk LLC, where I make and sell speech therapy materials. Also, this podcast is sponsored by Teach with Medley Educational Games. I am also the founder and manager of Pep Talk and the Pep Talk podcast. My non-financial disclosures include I have a stock participation plan with Teach with Medley, our sponsor for this podcast. Thank you to our sponsor, Teach with Medley Educational Games. This podcast is made possible because of your sponsorship. Now I will go over the learner objectives for this course. Number 1. You will be able to identify who the cycles approach is appropriate for. Number 2, you will be able to make a list of the primary patterns of the cycles approach. Number 3, you will be able to identify characteristics of appropriate target words for a specific primary pattern in the cycles approach. Number 4, you will be able to tell how to use target words with the cycles approach in a therapy session. Now let's get started. Okay, here we go. This is the first episode of the Pep Talk podcast. I am very excited to have Suzanne Aldrich with me today. Hi, Suzanne.
Hi, Michelle.
Hi. Suzanne is going to walk us through choosing appropriate target words while using Hodson's cycles approach. Suzanne has been a licensed SLP for over a decade. She has a bachelor's degree in special education and a master's degree in speech-language pathology. Suzanne specializes in articulation disorders, phonological disorders, and childhood apraxia of speech. She is passionate about keeping up with current research and trainings. I see her on social media posting about the latest articles she's reading. That is very important to her. Suzanne and I share an uncommon personal life situation. We both had 3 kids in 3 years, so We're the crazy ones out there doing that. So with our youngest currently being 2, so we're in the thick of it right now, but still wanting to learn all we can. Suzanne Aldrich's financial disclosures include: Suzanne has a Teachers Pay Teachers store called Playing Speech, where she sells materials related to treating speech and language disorders. Her non-financial disclosures include no relevant non-financial disclosures. All right, Suzanne, tell me a little bit more about yourself.
Okay, so I'll give you a little bit of the speech first and then a couple personal tidbits. I started my career in the med SLP world, and I worked for 2 of the top rehabs in the country, one here in New Jersey and one in Texas. But when we moved back to New Jersey, I had to get out of the healthcare world, the burnout. So I moved to middle school, which was fascinating. I loved it, and I loved all the language. But then I started having babies, so resigned from the middle school. And I started seeing clients privately in their homes, all the while still doing early intervention. So I've kind of run the gamut of speech therapy from birth to geriatric. But currently right now, it's just solely my private practice where I focus on speech sound disorders and early language, 0 to preschool-ish age. And then if you want to know anything about me personally, I don't have a time for a lot of hobbies with the 3 kids, ages 5, 4, and 2. So when I'm not, chasing them around, I'm reading all of the things for fun or research. And that's pretty much it. That's really all I have time for.
Yeah, that's great. That's great. So tell me a little bit about how you accumulated all of your knowledge and experience with the cycles approach.
Yeah, well, so to be honest, I don't remember exactly how I came across this approach, but I know I didn't learn it in grad school. And, I think I just started going down the rabbit hole of journal articles and I think I even listened to a podcast, bought some textbooks online. I started to try to teach myself, and I realized not everything was in one place, and there was all of this different information. So I just had to build it myself from different sources. And then what I found really helpful was anytime I could find a webinar that was done by Barbara Hodson herself, I signed up. It didn't matter what it cost. I was like, I'm gonna pay anything to hear her. So that was it. And then I just jumped right in and started implementing the approach and learning through experience, I guess you could say. Let me tell you my cycles story. Let me tell you my first cycles client. And now that I'm thinking about it, this is my cycles origin story and why I started to research this approach, because I was like, I have this very highly unintelligible, just turned 3-year-old, and her mom is a speech therapist. What am I going to do? So I think that's how I started going down the rabbit hole. I was looking up, phonological interventions for preschoolers. And this was, a few years ago. And I came upon the cycles approach. And so she was highly unintelligible, this child. She had a ton of patterns. And like I said, mom was an SLP. And I know we got through 2 to 3 cycles and the intelligibility just took off. Like, the child's own mother couldn't understand her, who was an SLP. And by the end of our 3rd cycle, everyone was understanding her. And we moved on then we went to minimal pairs. And then finally, all that was left for this child was that vocalic R. She even had initial R and R in blends. And I credit that to working on it so early on in cycles. So she had all those pre-vocalic and R and those R blends, and then just left off with just a vocalic R. So she's like, I call her my magnum opus, because we went through every phono, it took her from completely unintelligible to intelligible, and we went through cycles, minimal pairs, Arctic approach by the end, and so that's the testament to the beauty of cycles, the magic of cycles.
That's awesome. And wow, yeah, Suzanne, whenever you see that progress in a client that you're working with, that's why we do what we do. That's seriously the coolest thing to see, and to see the parents be so happy, and it's life-changing. It really, really is. And to see how the cycles approach works so well.
I have to say, mom being an SLP was a help too, because I did send home words for her to practice, and I know mom did them faithfully every week, and you could just see the progress in that child because of all of the, the home practice too. I don't say that to make people feel bad, like, oh, I can't get my families to practice at home. But just when you see that carryover at home, it just makes the growth exponential.
Yes, yes. And you can tell sometimes too, like, I know you're working at home. This is so amazing. Thank you. And it's working so well. That's awesome that you have a story like that just really catapulted you to wanting to learn more about the cycles approach and become an expert in it.
Yeah, it's funny because like when you asked what made me start to learn about the cycles approach, I was like, I don't remember. But then I was thinking of the story and I was like, this is why, she was why. And yeah, so I'm glad that I did that. I had that client.
That's awesome. Yeah, that is extremely helpful. I know I've struggled to feel confident with the cycles approach. I'm really looking forward to hearing all of what you're about to teach us. Let's first make sure we all understand exactly what the cycles approach is. I know I learned about it in grad school a little bit, but it's been a while and I want us all to feel very confident in how to use the cycles approach correctly. Suzanne, what is the cycles approach?
Okay, so in a nutshell, it's a phonological intervention. So it's something that you're going to use to treat a child with a phonological disorder, not a child with an articulation disorder, not a child with CAS. However, you will see sometimes those children who have both a phonological order and a CAS, and you may use cycles with that type of child, but I want to stress that it is a phonological intervention for a phonological disorder. And then I think this is the big one that a lot of people don't understand about the cycles approach, that the overarching goal of cycles is to improve overall intelligibility. It's not to master specific sounds. So I think that's a hard one for people to grasp and wrap their heads around. And then, what the cycles approach is meant to do is mimic the gradual phonological development that you see in natural speech acquisition. So, that's cycles in a nutshell.
Cycles in a nutshell. Thank you for that, Suzanne. A phonological intervention to increase intelligibility. All right, so who is the cycles approach appropriate for then?
So, like I said, it's going to be a child with a phonological disorder. They're highly unintelligible, extensive omissions and substitutions. So not the child who has a couple of phonological errors. This is going to be a child with, extensive phonological errors, limited consonant repertoires, and it can be used with really young children and also even, children who are cognitively delayed or have other diagnoses.
Yes, I was reading about the importance of early intervention for toddlers. Once the child is 5 years old, if they're unintelligible, it can impact their literacy acquisition. So using the cycles approach, if it's appropriate for those 2-year-olds, 3-year-olds, 4-year-olds that are highly unintelligible, it can really be beneficial before they enter school.
As soon as I can, I'm bringing out grapheme cards to link them with the speech sound. We're always incorporating those metaphonological activities because of that literacy piece.
Intelligibility over phoneme acquisition can be a more meaningful measure for young children. Having a significant delayed intelligibility can really affect their literacy acquisition when they get to school. Configuring their intelligibility can be collecting a spontaneous speech sample of at least 100 words and have an unfamiliar listener write a dash if they don't understand the word or a check if they do understand the word, and you can tally them up and see what percentage the child is understood. This is great, Suzanne. Next, I would like you to tell me exactly what a cycle is then.
Okay, so this is the big piece, right? What is a cycle? It's the period of time it takes for you to facilitate every phonological pattern in the primary patterns and every phoneme within those patterns, each one for 60 minutes. So a cycle would be all your primary patterns and all the phonemes within those patterns. That's one cycle. The length of each cycle depends on how many primary patterns you're going to target and how many phonemes within those patterns you're going to target. So the length of each cycle will vary. So yeah, once you've addressed all of those primary patterns and all the phonemes, then you've completed one full cycle.
Okay, so it's going to vary from client to client depending on how many primary patterns and phonemes that they're working on. That makes sense. So one cycle could be a long time. It could take a while. So next, let's dive in a little deeper on those primary patterns.
Okay, so there's first, syllableness. And this is the child who is monosyllabic. You're not targeting weak syllable deletion. A child says nana for banana. We're not going to look at syllableness. But, if a child is saying ba for baby and ma for monkey, then you're going to look at that primary pattern of syllableness. The next thing you'll look at is singleton consonant omissions. And the way I conceptualize that in my head is final consonant deletion and initial consonant deletion. There's times where you will address medial consonant deletion, but I feel like that's more rare, and what you'll really the really primary patterns you're going to focus on are going to be final consonant deletion and initial consonant deletion. Then you're going to look at S clusters, and in this primary pattern, you're not looking at S clusters for the child who has a substitution. So a child who's saying swide for slide, you're not going to target those S clusters. It's for the reduction of those clusters. So a child who's saying dot for stop or even sop for stop. And then you'll look at what Hodson calls anterior-posterior contrasts or fronting or backing. So the child who says tat for cat, and you're not going to target fronting and backing. It's, the child will probably have one or the other. And then the last primary pattern is gliding. So the child who says wat for rat or weef for leaf.
Yeah, so these primary patterns are specific phonological processes, syllableness, consonant omissions, S clusters, fronting, backing, and gliding. Tell me a little bit more about these patterns. So do I need to go in that order when I'm going through the cycles approach? And tell me again a little bit more about, so I really can understand how long I need to treat each pattern.
So you don't have to go in that specific order, but it makes sense to kind of start with syllableness, go to initial consonant deletion, and final consonant deletion. But you are only going to target the patterns that, one, the child actually needs to target. So you don't just target syllableness to target syllableness. If the child is speaking in 2 and 3 syllable words consistently, you can skip that pattern. And you also will not work on any patterns that the child is not stimulable for. That's a big component of the cycles approach. The child has to be stimulable for the targets and the patterns that you are going to address. So yes, it's a general outline to go in that order. And then how long you're going to treat each pattern depends on how many sounds within that pattern the child is stimulable for. So if you're targeting, the S clusters, if the child is only stimulable for SK and SL, those were like the worst two to pick because they're the hardest. But let's say magically the child is stimulable for SK and SL, then you're only going to target SK for 1 hour and SL for 1 hour. You're not going to target every other S cluster available to you because the child's not stimulable for it. So maybe child 1 is targeting S clusters for 2 hours and child number 2 is targeting S clusters for 4 hours. Something to remember is, though, you will only target each pattern for a maximum of 6 hours. So this really comes into play with the S clusters because there's 9 or so options for you to choose when targeting S clusters, but you're only going to target a maximum of 6 of them.
Yeah, this is something I really want to highlight because this is the main thing I've been confused about with the cycles approach is that you do skip patterns if they can already produce that sound, except for liquids. Is that correct?
So let me be clear. Yes, you're going to skip patterns that the child is stimulable for. So if they're already producing that pattern in their speech, why would you target it? You're just kind of wasting your therapy time, right? You also would skip patterns that the child needs to work on if they are not stimulable for them. So those are times when you'll skip patterns. But let's talk about the liquids, because maybe this child is a unicorn and they can produce L's and R's, then you would skip that pattern. Any other time, if the child cannot produce the L or the R, the liquids, you are going to target that pattern. This is the only exception to that. The child needs to be stimulable to target the sound rule. So you're always going to target the initial L and initial R in your first and subsequent cycles. But when you target these liquids, you don't have to set yourself up and the child up for the expectation that you're going to produce these perfect L's and R's. The main goal here when you're working on these liquids is just to quote facilitate the liquids is what Hodson says. You're looking to just suppress the gliding, like make the L and the R better. So even though you're going to target that initially right off the bat with every child, don't set yourself up to think, oh my gosh, I have to elicit this perfect R from this kid. You don't. You're just trying to, like I said, quote, quote, facilitate them.
Right. That's so interesting with the liquids that you really need to try to facilitate that, even if they are not stimulable for R and L. So tell me, I'm always interested in the science behind why we do things. So why exactly do you work on those later developing R and L sounds when a child is very unintelligible, very hard to understand? What's the science behind that? Why do you work on R and L with the cycles approach?
So with the cycles approach, the idea behind facilitating those liquids is just not to reinforce that incorrect motokinesthetic image. Like you don't want the child just, practicing that incorrect R and L forever until you correct all these other things first, because then you're just giving them more time to habituate that errored pattern. So if you wait to target the L and the R before this child, if you wait until this child corrects all these other phonological patterns, the child's gonna be 8, 9 before you get to the L and the R. So the idea is to get it in there, get it in the mix of what you're targeting so that the child has exposure to it and you're not letting them just continually use this incorrect pattern.
That makes a lot of sense. That really does. Okay, so say I have a child that I want to use this approach on. How do I go about choosing target words?
Okay, so this is really important because the whole idea of cycles is that the child has to be stimulable for these targets, and they should be like easy wins. They have highly facilitative contexts that make the word like a lob for the kid to say. That's how I think of it. So, once you've determined your patterns that you're going to address and which phonemes within those patterns that you're going to address, let's say we're talking about final consonant deletion and you're going to target final T and final P and final M. You're going to choose 3 to 5 words for each of those final sounds. So let's say 5 final T words, 5 final M words, 5 final P words. And these words are going to be easy words. So when you're choosing final T words, you want them to have highly facilitative context so the child can practice that word accurately and get the correct, as Hodson calls it, motokinesthetic pattern.
Carefully choosing your target words is so important. My analogy for this, similar to what you said, is that we're playing T-ball, not fast pitch. We want to help them as much as possible, but they are still swinging the bat. We want the child to produce all of the target words correctly to reinforce that motokinesthetic pattern. The child must be stimulable for those sounds, and the complexity of the words that you choose are to be increased very gradually. We want those words to be easy wins, like you said. We need them to have 100% accuracy when they're practicing, so they're not practicing it the wrong way. I don't need to choose words that have difficult sounds for the child. We want the child to focus on the sound they're working on and produce it with 100% accuracy. You want to choose just the easiest words for them to work on.
You want the easiest word. You want to avoid any sounds that are made in the same place as the errored sound. So let's say we're working on that final T because the child is, that's a bad example. let's say the child is fronting and you're working on trying to elicit the initial K. You're not going to choose the word cat because it has a T on the end. It's not gonna, right. That's not facilitative. That's gonna influence that initial K and you're probably gonna keep getting a tat. If you're working on final consonant deletion, you're trying to get VC, vowel consonant shapes to make it just easier.
Right, Suzanne, that makes a lot of sense. Making the word simple for them so they can have those easy wins. Okay, so my next question is, how many target words do we need per session or per pattern?
So you would ideally have, 3 to 5 words for your treatment set, and you would target them for that hour. If you have a full hour session, you're going to target them for the full hour. If you have 2 30-minute sessions, then you're going to do those 3 to 5 words in your first 30-minute session and in your second 30-minute session. So you get that total of 1 hour of that phoneme, and then you're going to move on. It's an hour per phoneme for every phoneme that's stimulable within that pattern.
Right. So even if you saw the kid for 2 30-minute sessions, you would work on the same one one day, and then also on the second day you saw them. So once I have my target words, can you outline what a therapy session might look like? Since it sounds like you're going to be asking this child to say the same words over and over again, what are some tips and tricks that you have in mind for that? Just explain kind of how that might look.
Okay, so first of all, Cycles has a very predictable outline. The way it's laid out in the literature, you're always going to follow this outline for your treatment session. So the first thing you're going to do, if appropriate, if it's not session 1, you're going to review the old targets from the previous session. And the way I do that is I just kind of flip through like the 3 cards that we did the last session, and I'm like, what's this, what's this, what's this. So that doesn't have to take long. And then you move on to the auditory bombardment. And what this is the child listens to a word list that contains the target that you're going to be working on for that day, with amplification. So if you're working again, like on Final T, the child's just going to wear headphones. It's going to be amplified in their ears. And all they're going to do is they're going to be listening to a word list of all words that end in Final T. These words don't matter. They can be a little more complex than what you're going to have them say. It's just they all end with the target of the day, or they all contain the target of the day, I should say. After they do that auditory bombardment, which should take, a minute to get through a word list, a minute to 2 minutes, the child just can sit quietly doing an activity while the headphones are on. After the auditory bombardment is completed, you're going to then introduce and practice your new targets. So, the way I do this, if it's a child who can with cards, I will, show them picture cards. We'll review what the cards are, what the words are. We'll produce them together, and then we'll jump into whatever the activity is going to be to produce those targets. So I'll go back to that. But then after the practice, after you've gotten all your practice in for the session, which is the meat of your session, you're going to do a metaphonological activity, and I like to make this activity tied to whatever the target is. So I keep using this example of Final T, but if we're focusing on words with Final T, I might say, and one of our targets was hat. I might be like, okay, here's hat. Tell me which word rhymes with hat, bat or cape, and, incorporate it that way. You could also say, what sound do you hear at the end of the word hat? Oh, I hear T, so that any of that kind of phonological awareness activity. But I usually like to tie it to whatever the target was. And then you're going to do a stimulability check for your next week's targets. So, if you were targeting Final T and you think next week you're going to target Final P, just run through really quickly, see if the child can produce those words with Final P. Because, sometimes like you'll do the eval and you'll think, oh, the kid, this child's going to be able to do this. And then you get into the moment and they can't. So you always want to, always want to check and make sure that your next week is going to be a stimulable target, because that's the whole point. And then you finish up with the auditory bombardment again. So same word list, put on your amplification, listen to the word list for a minute, 2 minutes, and then you're done. You could send home practice.
That's awesome, Suzanne. Okay, so you review old targets, you do auditory bombardment, you introduce and practice your target words, do a phonological awareness activity, then do a stimulability check for next week's target, then finish with auditory bombardment. What kind of homework or home practice do you send home with the parents?
So this depends on the child, because one, we do not want them to practice anything incorrectly. Like that is one of the main points of Cycles. You're always practicing accurate productions. So let's say if it's a child I don't think is going to go home and be able to practice the words accurately without all of the SLP assistance, I'll just send home the listening list. Have the parents read it twice a day, morning, night. You can send home practice words if you're confident that the child will be able to produce them. I've done this in the case where the mom was an SLP, but I've kind of rarely done that, just because I don't want them to practice incorrectly. So yeah, those are a couple of things. You could send home phonological awareness tasks related to your target of that week. It just depends on the child, I think.
For the auditory bombardment homework, do you want the parents to use headphones or any kind of, is that required?
I mean,
for the
ideally,
homework,
yeah, you'd want them to use
yeah.
headphones. So what they could even do, and what I've suggested to parents, is record themselves on their phones, like voice memo, and then you can put the earbuds in that come with like the iPhone, and just crank up the volume a little, so it doesn't have to be like a dedicated system to amplify the sound. We can all just use our iPhones at this point.
That's so true. So true. All right, let's go over some real therapy examples now.
Okay, so let's hypothetically start at assessment. You are assessing this child in front of you. You can use a formalized assessment, or you can, use an informalized measure. But what you're going to do is address patterns that are present more than 40% of the time in a child's speech. So let's pretend this hypothetical child needs to address all of the primary patterns in cycles. So you would start at syllableness, and the first thing you would address there is 2-syllable productions. What Hodson recommends is using compound words if possible, so things like rainbow, cowboy, but you can also use just 2-syllable words like hippo. And you're going to work on that first, I won't call that a phoneme, but that first target set for an hour. And then you would work on 3-syllable productions for that child. Again, you're going to try to look at compound words. So I like to do baseball bat, cowboy hat. So you can kind of build off some of the 2-syllable compound words: cowboy, cowboy hat, baseball, baseball bat. So you're going to do that for an hour. Then you've covered your syllableness primary pattern. The next thing you'll look at is the final consonant deletion. So here you'll find the final consonants that this child is stimulable for. So you're going to work on each final consonant on its own for an hour. So you can start with let's say final T. You're going to have 3 to 5 final T target words. I can give you some examples of some good final T target words that are facilitative and monosyllabic. So you'll look at words like hat, bat, eat. If you can get a VC syllable shape, I think, that's your best bet. And then looking at easy CVCs. So you'll work on that set for an hour, and then you'll go to your next final consonant. Let's say that's final P. Words like up, hop, map. So you're looking for 3 to 5 target words, final P. Work on them for an hour with this child. You'll go through that with final M, final N, all if the child is stimulable for them. Once you finish final consonant deletion, you can look at initial consonant deletion. You can kind of flip-flop those two if you want. Initial consonant deletion first, and then final consonant deletion. But when you look at initial consonant deletion, Hodson recommends looking at the bilabials, or the things that are easy to see. P's, B's, M's, W, but you can also look at T, D, and H. And I always say, nothing is written in stone. Let's say if you have a child who has initial consonant deletion and they need to address this pattern, and they're not stimulable for the P's and the B's and the M's, but you can get them stimulable for an S or an F. I say give it a shot. That may not be quote unquote textbook, but I think it's an option that you can look at. So, if you're on the initial consonant deletion pattern and you're looking for words that start with, let's say, initial B, you're going to look for CV shapes if you can, boo, bye, and then CVC would be your next bet, because you want those, monosyllabic, highly facilitative context. After you go through initial consonant deletion, you can look at fronting or backing. Let's say this child is fronting. So you're going to start with initial K, final K, and initial G. You don't want to work on voiced final stops because it encourages that intrusive schwa, like bag. And the theory too also is if you get the final voiceless, it'll carry over to the final voiced. So when you're looking at fronting or backing, you're not going to do final G or you're not going to do final D. But if you're targeting final K as your first set in that fronting primary pattern, you're going to look at words like bake and ache, and to, again, get VC syllable shapes or easy CBCs. You're not going to include words that have, or you're going to try not to include words that have sounds in the same place as the erred sound. So I try to avoid, in this case, all alveolars. So I don't like the word sick for a child who fronting, because the S is made in the front of your mouth and then you're trying to get them to the back for a K. That would be a later cycle. Like I might try to throw a word like that in when I want to increase the complexity a little bit. And then so, you target your final K words for an hour and then you just move on. You target your initial K words for an hour, your initial G words for an hour, and move on. And then once you do all of that, you're going to look at your S clusters. And this is where a lot of your time is spent because there's so many options for S clusters. Or maybe you don't spend a lot of time because the child's not stimulable for any of them. But let's hypothetically say this child is a unicorn and is stimulable for all of the possibilities in the S cluster primary pattern. You're not going to target every single one because you're only going to target a maximum of 6 sounds in any primary pattern. So you can look at final TS, and that's words like, I like plurals like hats, bats, cats. Target that for an hour. You can look at final PS, and it's the same idea. Maps, hops, oops. And then you can also look at final KS, but a lot of times the child's not stimulable for that K. So that's one I usually end up skipping. But you can do books, bikes, and then you're looking at your initial S clusters. So initial SP words you'll look at for an hour. Words like spin, spill, spot. Initial ST, stop, stay. And then if you get to like initial SN and initial SM, because again, you're only focusing on 6. Words like snow, snap, snack is an okay one. That K sometimes throws kids off. SM, small, smell, smile. I feel like those are hard a lot of times because of the words that start with SM. There's always some like difficult phoneme somewhere embedded in that word. So sometimes those are, if I can, I will skip like SM because like I said, there's so many S cluster options. So you can, there's some that you're not going to address. And then you got to the gliding, the piece that you are never going to skip unless the child is producing initial R and initial L in their speech, then obviously we're going to skip it. We don't need to address something that the child is capable of doing, but you're always going to address initial L and you're always going to address initial R regardless of stimulability. And you're going to work on just facilitating better production, suppressing the gliding. You're not looking for perfect L's. You're not looking for perfect R's. Although I will say it's easier to get a pretty good L sometimes than an initial R. And so let's say you're working on your initial R words for your hour. You're also going to want to look at words that have facilitative context, even though, you're not shooting for perfection. So I'll look at words with like high vowels like read, or, even sometimes those, it all depends on the kid, which R word is facilitative. So I kind of run through a few different vowel options to see which one hits with the kid or which area on the vowel quadrilateral will hit with the kid. And same for initial L. You're not going to want to do a word like, I'm trying to think of a word that has a glide somewhere in it. Like sometimes lay and low are a little more difficult, but they're nice syllable shapes. So who knows? You just kind of got to give it a shot. And then you've hit all of the primary patterns and all of the phonemes within those primary patterns at that point, and you're at the end of a full cycle for this child who needed to address every pattern.
That's perfect. That really just clicked in my mind to be able to hear all those examples. That was so helpful.
Yeah, and I always find that if I see it visually rather than just explaining it, like as soon as you see a visual, it clicks for people. They're like, oh, this makes sense.
So let's talk a little bit about when it's time to move on.
So from cycles in general or from a particular pattern?
Let's start with, let's talk about both. Let's start with each pattern.
Okay, so you're going to discontinue targeting a pattern when you start to hear it emerging in a child's conversational speech. And to me, I follow the general guideline of 40 to 50% of the time. When you're first evaluating a child for use, to see if they're appropriate for the cycles approach, the recommendation is that they show these deviant phonological patterns more than 40% of the time in their speech. So that's the guideline I go off of when I determine like, okay, it's emerging in conversation more than 40 to 50% of the time. So we can discontinue using that pattern. Okay. Particular phonemes within the pattern, if you start to hear like, let's say you still don't hear final consonant deletion resolving enough, but you start to hear like final T is coming out pretty consistently. You can remove the final T from your final consonant deletion lineup, but still target final consonant deletion with the other phonemes if you're not hearing them. Does that make sense?
Yeah, that makes sense. Okay, so what are some signs that this approach is working well for a specific child versus when it might be time to move on from the whole cycles approach? Like, how do you know that this approach is working well for your specific client?
So a lot of the research will say it takes 2 to 3 cycles to even see, improvements in the intelligibility. So first, like I would say, don't give up right away. If you go through one cycle and you're like, this isn't working, it doesn't generally work in one cycle. But I would say if you are seeing improvement, if the child's, a bunch of the patterns start to resolve and the child's becoming more intelligible, like they become, if now their phonological impairment is mild to moderate versus moderate to severe, then I would say look at the approach again and maybe you can change it to something else. Like at that time, sometimes I'll switch to minimal pairs or something like that. That's not as not as geared towards somebody who is more severely, on the severe end of the phonological disorder spectrum. And I also think you have to look at the child, like, are they having a good time with this approach? That's the thing I consider. Is the child, they come to speech and they're like, this, I can't do this. I don't want to do this. Maybe you need to find another approach. I think cycles is one that a lot of kids feel good about because you're only addressing those stimulable sounds. So they're successful a lot of the time. But, there are those cases where it might just not fit with the child you think it's going to fit with.
Right. And I love how you talked about how you're not going to see progress right away. And I know that's where I struggle in therapy the most. You have a parent bringing their child and you're like, I want you to have progress every session and it be amazing. I just have to remember that every kid, every situation may be a little bit different, but shoot for that 1 hour a week as best you can. It is hard when parents ask for a timeline or they're paying out of pocket and you want to see results right away. But remember to be patient and consistent because that's when you see the progress.
I have the same problem. Like, I want immediate results. And I know that's not always the case. And remember, one cycle itself could be 12 to 14 weeks. And that's if you have the full hour session. So if let's say you're seeing the child for an hour a week and you're targeting one phoneme within a pattern each week, you may have 12 to 14 different targets, 12 to 14 different weeks where to get through the first cycle. So what is that? 3 months? Yeah. 3 months before you're even through the first cycle. So now times 3 is 9 months.
If you're doing 30-minute sessions that would take a long time. So
I know this is a lot of math for speech therapists.
It really is. I don't have my degree in math. Do you often then also recommend to parents hour-long sessions? Of course, this would be, in the schools, you might not always have the flexibility for this, but what do you recommend to parents when you're setting up your treatment plan?
I'll be honest, like for me, because I have the luxury of working in private practice, I prefer 2 30 minutes a week. Just because they're so little. I rarely meet the 4-year-old who's like, I'm going to sit there for an hour and we're going to work, Right. I don't think that's out of the norm. I think that's a lot of 4-year-olds. So if I can, 2 30 minutes to me it's more desirable than the 1 60-minute. But, you work with what you have.
Right. Having their full attention is a lot better than just forcing it for even longer. I definitely agree.
You could force the 60 minutes and say, oh, I did my full 60 minutes in a week, but like, was it a good 60 minutes? Could it have been better if it was, 230? So that's how I look at it.
And those young children, those that are nonverbal, those unwilling to participate, can go through a cycle still that just focuses on auditory input for their primary patterns. Suzanne, have you gone through an auditory input cycle?
I think doing something like focused auditory input in combination with a sort of stimulability approach is more the route I take because, like you said, it's great that we're just going to bombard them with final P words for an hour and then we're going to bombard them with final T words for an hour. Cool. But I also still try to get them to produce something for me, like become more stimulable for sounds because you're just listening. Who knows if, you're going to then be able to produce it. So I hybrid focused auditory input with like stimulability and do that route, which again is, not textbook and it's not in the literature, but I feel like that's real world.
Right. That makes the most sense to me. Let's see. Do you have a story where you decided to not do the cycles approach?
I feel like a lot of the unintelligible preschoolers can benefit or usually are pretty appropriate for the cycles approach. But, there are times where I will come across a preschooler who just has a few phonological errors. And at that point, I'll do something like minimal pairs. Or if I have a preschooler who has something like a phoneme collapse, I'll try to get multiple oppositions going. So a child like those, I wouldn't probably consider the cycles approach first.
That's great, Suzanne. Can you tell me more about why and how the cycles approach works? What is actually going on in there, so to speak? How does it work?
Yeah, so there's a few theoretical concepts of why, the cycles approach is beneficial. And the first one is that typical children acquire phonology gradually. Like we don't learn all P first and then we move on to M and then we move on to B. So the idea is you work in that cyclical fashion to mimic basically how children typically acquire their phonology. And then another important component or theoretical underpinning of the cycles approach is that normal speech is acquired by listening. We listen, we hear, and we repeat. So that's why that auditory bombardment piece is important. It's to, draw attention to that audio that maybe the child's not getting just normally. So, you're giving them that extra boost of listening because, the theory is that's how we normally acquire our phonological system.
Exactly. Parents aren't out there teaching their babies and toddlers where to place their tongue, how to produce each sound. They hear it and perceive it, then eventually try to produce it and hopefully produce it correctly. Tell me a little bit more why we only want to use stimulable targets when we're choosing our target words.
We're only using stimulable targets with facilitative context because another component or theoretical underpinning of cycles is that we only want the child practicing correctly. We don't want to reinforce the wrong kinesthetic image. We don't want to reinforce the wrong motor pattern. The other reason, another theoretical component to the cycles approach is that why we're using those stimulable sounds and patterns is because we want to work within the child's zone of proximal development. So just a level above what they're doing now.
Yeah, so they're challenged, but they're successful.
So it's still challenging, but they're successful. And that leads to, quicker learning and generalization. So those are some of the reasons why the cycles approach is designed the way that it is.
That's so interesting. I love to hear about the science and the why I'm doing something. I feel like I do better if I know what it's actually doing in the brain and why it's going to work. That's really neat.
I agree.
So say you have a kiddo that is absent a lot, does that really throw things off?
I would say yes. I mean, you want to be consistent, you want to... The idea is you have your 2 30-minute sessions in the same week, your 4 15-minute sessions in the same week. It's not a 15-minute on Monday, a 15-minute on the next Monday, and then a 15-minute the following Monday. It all needs to kind of be consolidated within that week. There is some wiggle room for the 2 30s and the 4 15s, but they should be within the same week. So a kid who's absent a lot, maybe what approach is going to work for that kid? They're just not there. Right. So cycles, minimal pairs, I don't think it matters at that point.
I know. In the private practice, I had a kid, I had several kids that, maybe all they could really afford is to do an every other week. And some people, if you're transitioning out, that's fine. I didn't recommend it often.
So I wouldn't.
An approach like this, you would probably just have to have a talk with the parents. You have to work with what you have. Now, Suzanne, I'd love for you to describe some therapy activities that work well for this approach.
Okay, so I'm going to tell you about some of my go-to cycles activities. So I kind of think of this in two different ideas. One is the kid who you can sit down and drill with the cards and the worksheets, and the other is the child who you have to focus on play-based activities. I don't think either are wrong, and I think there is a time and a place for both. And, we can get on that soapbox another time, but I don't think there's anything wrong with cards and drill if the child's going to do it and it works for that child. So, if you have that child, take out my cycles cards. I have them say the word 5 times, and then we get a turn in like a fast turn taking game. Crocodile dentist, pop the pig, all the go-tos that you can take a quick turn and then move on. So I'll do things like that. I have, full disclosure, self-created worksheets geared towards the cycles approach, with all the primary patterns that I'll use that you can get quick, high repetitions. That's not for every child. Not every child's going to sit there and do that with you, but that's another option. And then there's the child who you have to go full on play-based. And these are kind of my favorite kids because I love the challenge of trying to figure out how to fit my target words into whatever the play scheme is. So let's say we're targeting Final T and the child wants to play with train tracks. Now I have to come up with Final T words that are facilitative and easy for the kid to say that I can work into our play. And I think that is the fun challenge. I mean, you always have words like out and hit that you can pull from. There's a list that you can go to and then try to figure out how to incorporate those words into your play. But yeah, that's another way to go about targeting all those words. I have my own lists of target words. So I just, even if I'm going to do play-based, I whip out, the cards or the list and I say, okay, how can I work in, man and pan and moon into this game, whatever the words happen to be.
Awesome. So some high repetition, quick turn games, worksheets, play-based activities with on-topic target words. Some days I'm really good at thinking of appropriate target words during play on the spot. And some days I definitely need to have a list I can look at. I love hearing all of your ideas for therapy that have the child producing lots of repetitions. That's great.
Yeah. And I think that there's I gave you like kind of 3 different tracks that you could go. You could do the cards drill, quick game. You could do worksheets if the child's going to go for it, or play-based, and it all depends on the child in front of you.
Right. Yeah. And also maybe mixing it up, doing some of all of those and have them have options.
Absolutely. Yeah. You could do, a couple of minutes of drill, move on to a play game, play-based activity, and then go back to even the drill.
I don't know about everyone listening here, but I know Suzanne and I were talking about how we're very visual and we need to see things sometimes. If you want to have something you can hold in your hand and to look at that really spells this out, Suzanne does have a lot of cycles approach, visuals, and tools. Suzanne, can you tell me about some of the great resources that you have created?
The Cycles Complete Toolkit. So yes. I have that, but even, I also have a little freebie on my Teachers Pay Teachers store that it's like, to me, I love looking at it because it lays out all the primary patterns, and it lays out all the phonemes underneath those primary patterns that you can target. And it just, once you see that visual, you're like, oh, this makes so much sense.
Yeah, it is so helpful to be able to see it all mapped out. I will link your Cycles Approach visual in the show notes for anyone to download that for free.
Yeah, I feel like it's so hard to verbally explain without a visual component, like here's the primary patterns and here are your targets within those patterns.
Right.
So, always having a visual is easier for me.
Right. Even as you're talking, I tried to make little brackets of patterns, and I kind of drew it out even though I just wanted to visualize as you were talking. If you're out there on a run or driving a car, you definitely don't need to be looking at a paper, but you can later on go look it up, or you can definitely use an already made Cycles visual. Awesome.
There you go.
Awesome. Suzanne, let's give a quick summary of what you have taught us here today.
So just to summarize, the Cycles approach is a phonological intervention. You're going to use it with children who have a phonological disorder. You're going to use it with children who are highly unintelligible. You are going to target only primary patterns and phonemes within those primary patterns that the child is stimulable for. There are specific primary patterns that you should look at when using the Cycles approach, and that's syllabless, initial consonant deletion, final consonant deletion, S clusters, fronting or backing, and gliding. And you're going to target each phoneme within those primary patterns for an hour and then move on. You're not working towards any level of mastery. You're just working for that hour and you move on. When you've completed all of the primary patterns and all the phonemes within that primary pattern, then you've completed one full cycle. When you choose your target words for those phonemes within the primary patterns, you want to choose target words that are monosyllabic and contain highly facilitative contexts. These words need to be easy for the child to say so that they are practicing them correctly almost every single time. That's the goal, is 100% accurate productions. I know that's not completely attainable, but that's the lofty goal.
Yes, a lofty goal, but yes, that 100% accuracy is important, and these words need to be just challenging enough, but where the child is still successful.
Right? It doesn't really leave you with a lot of options for target words. I'm going to be honest. When I was coming up with word lists for targets, you really have to consider the words that you're choosing. So, if you're having trouble with that, I do have word lists that will make it easy for you. Because I really don't think that there's actually that many options when you think about using highly facilitative monosyllabic words. It narrows your field a lot.
Yes, that might be our take-home point from this entire podcast episode, is when choosing your target words for the cycles approach, think of those highly facilitative monosyllabic words. This has been so great, Suzanne. I have really enjoyed having you on this episode and really enjoyed chatting with you. This episode has been so informative. I am so thankful for Suzanne and all she has taught us here today. I hope you guys are able to go out there and feel more confident with the cycles approach, be able to efficiently choose target words that can best help your students. I know I've learned a lot here today, and I am so thrilled to have you here, Suzanne. Thank you for listening. We hope you learned something today. All of the references and resources throughout this episode are listed in the show notes and also listed on the Pep Talk Podcast for SLPs website. If you've been listening while you're driving, on a run, doing the dishes, this entire episode is transcribed for you to refer back to easily. Suzanne, thank you again for joining me today. You have been so great.
Thanks for having me.
Yeah, and if you are listening and you want to learn more about Suzanne, you can find her on Instagram, Facebook. She has a website, or you could email her with any questions, playingspeech@gmail.com. Thank you so much, Suzanne.
Thank you. It was good talking with you.
Anytime, Suzanne. I hope we can have you back soon. Thank you so much for listening to this episode on the Pep Talk Podcast. Remember, you can use this podcast episode for a professional development hour to maintain your ASHA CCCs. You must earn your certificate of completion in order to get credit. This podcast course is also TISHA certified. I live in Texas, so that stands for the Texas Speech and Hearing Association. All the references and information mentioned in today's episode are listed in the show notes. If you have any questions, comments, or concerns, or simply want to chat, please email me or find me on Instagram, Facebook, or go to peptalkpodcastforslps.com. Thank you for joining in and for continuing your education with me.